Hi, everyone. Thank you so much for coming out and spending Sunday with us to learn about multiple sclerosis, something that's obviously important to all of us, everyone in the room. So my portion of today's program is going to be on MS myth-busting. Why do we need this talk? Well, first of all, you just heard a little bit about the basics of multiple sclerosis, but the science of MS runs deep, and we know a great deal about it by 2011. But MS is a condition that lends itself not just to information and study, but also to misinformation and myths. And so as we teach everyone about MS, we also want to dispel rumors and try and give you all the tools to be critical thinkers, to be very, very skeptical of the things that you may hear about MS and reason through them in the same way that we do. So why does MS lend itself to myths? Well, of course, for everyone in this room who's been diagnosed with MS or cares for someone who is, MS can be an extremely frightening diagnosis, mysterious, and that uncertainty and that fear leads to a lot of untruths about MS floating around. We are somewhat responsible for that too. Clinicians, I have to admit, are not always the best at communicating things with our patients. And so we fail sometimes to communicate what we need to, and that sets up myths and misinformation. Our understanding about MS is evolving. This is not a finished science. We are still learning about it. And so what was true 10 years ago may not be true now. What's true now may not be true in 10 years as we learn more. So that changing understanding over time is a setup for myths and for wrong information to persist. MS, as all of you know, is extremely variable. It varies so much from one person to another, and even within one person with MS over time. That variability lends itself to myths because what's true for one person may not be true at all for somebody else. And MS, as many of you know, is often a relapsing condition, as Dr. Fabian described. Relapses of symptoms of MS may come, and then they may go. And it is human nature to try and figure out why that happened. What caused those symptoms that lasted for those few weeks and then allowed them to go away? So I always give the example that if someone had eaten a dozen bananas one day and then a week later they developed an MS attack, of course they would think that it must have been the bananas. But for someone else who has an MS attack, who then eats a dozen bananas while they have it, and those symptoms then go away, they're going to be convinced that the bananas were the cure. So relapses are a setup for misunderstandings because anything that correlates over time, we assume must be causative, must have caused what happened. And that is a fallacy of correlation, but not causation. Why else do myths persist? Well, I think that myths about MS come down to hope. And I think that just the fact that all of you are here today and listening to all of us and learning what we know is an example of real hope, good hope, and the fact that we have every reason to be hopeful that we are going to get better and better at taking care of this condition in the coming years. But there's also a lot of false hope out there, and people can pin their hopes on things that aren't real. And I think that myths persist in part because of that fear of the unknown and because of a desire to hope for things that maybe aren't yet ready for prime time. There's also what we think of as the allure of the anecdote. Everyone in this room, everyone, has a friend or a friend of a friend or a cousin who must have called you up at some point and said, I just heard something that you have to know. And for the most part, they're trying to be helpful. But anecdotes, one person's experience, are not great sources of data. And again, what's true for one person is oftentimes in MS not true for everybody else. We doctors and physicians and clinicians, we're human. We have this allure too, and when doctors talk about it, we call it a case report. That is, somewhere in the literature, something happened to one person, and we like to believe in that stuff also. But what we have learned is that in order to know things about MS, you need to study it. You need to study it with hundreds or thousands of people over real periods of time to get good quality data. So one of the things we're going to talk about today is what is good data in MS and how is it generated and what does it take for a myth to become a fact or a myth to be disproved. I would add that we know what we know and we don't yet know what we don't know. It's my way of talking about humility, and I think that all of us who take care of patients with MS have to be humble and aware that our knowledge is changing and that we have things to learn from everyone. I'll add that it's very easy to start a myth, and it's very hard to stop one once it's out there. That speaks to what Aaron just mentioned, is the power of the internet. Back when I was doing my MD degree at Yale, I did a thesis on the effect of the internet on the doctor-patient relationship. And what I ended up finding is if a physician didn't take seriously the concerns that their patients were bringing to them that they saw online, those patients were going to find another doctor. And that was a while ago. That was 12 years ago, and it is only more true now. So the internet is a wonderful, powerful, open resource. It facilitates patient education like nothing else in the history of modern times. The problem is, in our egalitarian world, everybody with an opinion can post it online, and those opinions can spread around the world just as fast for one person as they can for a scientist or for someone who's done real studies. Everyone can be an expert in our blog culture. I think that is very important, but it also means you have to approach everything you read with more skepticism than ever before. I would give you two major caveats. If something you read online sounds too good to be true, someone's trying to sell you something. If something you read online sounds catastrophic, sounds like a terrible, terrible story, if it's true, it's probably a rare case. It's not representative. And this is true for all media. The media skews towards big, bad, scary stories. The media does not talk about everyday experiences. So all of you have had symptoms, and probably very few of you have posted these stories online. You've lived and not necessarily disseminated that information, normal life information, people living with the condition and surviving and doing well. That's not the kind of stuff that occupies a lot of space and time on the internet. So, my goals of this talk, and this is actually part of a much larger talk where we talk about a lot of myths. We're just going to do a couple of them today, and Dr. Ben-Zachariah and I are going to split them. But we want to fight bad information with good information. We want to accept that we don't yet know everything. We want to approach things with an open mind and a healthy set of skepticism, and name some names where some valid work has been done and give that work its due, and give you a framework for thinking about myths about MS. Here's my first example. This is actually the thing that made me design this talk in the first place a few years ago. My father, when I was studying MS at Mount Sinai, sent me this email. He said, "Stephen, you might want to know about this." Again, good intentions. MS is caused by artificial sweeteners. Here's what this email said. I'm going to summarize it for you. I'm not going to read the whole thing. This email went around the world a few million times, I want to add. In October of 2005, my sister got very sick. She had stomach spasms. She couldn't get around. Walking was a chore. It took everything she had to get out of bed. By March of 2006, she was on 24 medicines. She knew she was dying. Her doctors couldn't tell her anything. In March, I called her to ask how she was. I recalled an article talking about diet soda. I asked her if she drank diet soda. She said she did, and she was going to crack one open that very moment. I told her not to open it and put it down. Stop drinking diet soda. Within 32 hours, she was all better and she could walk. The muscle spasms went away. She was going to bring this article to her doctor. I always wonder how that worked out. In a nutshell, she was being poisoned by the aspartame in the diet soda. She was dying a miserable death. She's now walking. She has no wheelchair. The article saved her life. Also, this seems to cause tinnitus and fibromyalgia and lupus and ADHD and Gulf War syndrome. But if you eat stevia instead, which is a sweet herb, not something manufactured, that would be a cure. You wouldn't have to drink diet soda, but the FDA doesn't want you to know about it because they're in cahoots with some chemical company. This is not true.
Aspartame is dangerous.
There you go.
It is dangerous. Don't tell people aspartame is not dangerous.
So I think it's
Any other disease.
good. So I think it's really important that individual perceptions of this stuff get heard. But what I want you to understand is what the data actually does and doesn't look like regarding MS specifically. So as the MS Foundation says, there's no evidence for epidemics of MS or lupus or these other conditions, and there hasn't been any research that looks at people to show that sort of causality. I would also add that MS is not a new disease. It's an old disease. MS has been around for hundreds of years. Charcot, who discovered and named MS 150 years ago, wrote really elegantly and eloquently about people with MS and how they suffered and what could be done for them. And this was in the 1860s, long before things like aspartame were on anybody's lips. I would add the following. I got skeptical. I looked at this email. I traced it back. You know how when you get these forwarded emails, they have 100 people it was sent to, and then another 100, another 100, another 100. So I went back. I looked all the way back up the chain. I dug through it. And eventually I found that it came from a person who works for a company called PRCnet.com, which is a marketing company hired by businesses to market their products. And one of their products was stevia, the harmless sweetener, which is now being marketed, and actually we have it in packets out there, which always makes me laugh. I kind of boycott stevia just from this purposes, although I don't think it's the same company. But this is classic fear marketing. This is a telemarketing company that sent this out and disseminated it across the world so that you'd be afraid of a particular additive so they could sell you a different one. So there is no data, no scientific data in large numbers of people to suggest that MS or lupus or Gulf War syndrome is caused by this. And you have to be very careful when you look at this stuff. If someone's trying to not get you to buy something, they may well be trying to sell you something else. This kind of leads into the next myth or next idea, which is that cutting particular things out of the diet will help MS in a more general sense. And if you look online and look in bookstores, there are a lot of books about dietary cures for MS. And I would encourage you to be very skeptical of all of them. This is actually a quote from Aaron Miller, who spoke earlier. There have been lots of claims made over the years about special diets for MS, but none of them have held up in studies. Many of these fad diets will come and go, and they will often encourage people to cut a particular thing out of their diet or to take enormous amounts of something else. None of that has ever been shown in population studies to make a difference for multiple sclerosis. And what I tell my patients and what Aaron does is to eat a low-fat, well-balanced, high-fiber diet from the principles of general health and medical well-being, but not to ascribe to a particular diet that would encourage you to cut something that you enjoy out of it for the specific purpose of helping MS. So what about the best known of these? What about the Swank diet? Many of you may have heard of the Swank diet. And I'll tell you a little bit about that study, because to Swank's credit, he actually did do a study of this, and so it's worth mentioning what it does and doesn't tell us. So Swank performed or recommended a trial of this very ultra low-fat diet, 250 patients between 1948 and 1952. So this is a long time ago. And not to get into all the details, but about 144 patients were placed on the low-fat diet. And before the study, their fat content had been 125 grams a day of saturated fat. About 70 of these patients adhered strictly to this ultra-low-fat diet. And the others, these were called the good dieters. And the other 74 were called the poor dieters, deviated from it and didn't stick with this ultra-low-fat diet. And over the next 35 years, about 23 people died amongst the good dieters, and 70 people and 58 people died of the poor dieters over the ensuing 34 years. When they looked at those survivors, they looked at who had adhered and who hadn't adhered over this long period of time. But I would point out that in the first 15 years, they actually hadn't been followed regularly. So there was no close follow-up to look at what was actually happening to these people. The results, the way they called the results of this study were the following. The study indicated that, in all probability, MS is caused by the consumption of saturated animal fat. There's some problems with this conclusion. It mixes up cause and effect. This study wasn't designed, first of all, to tell us what caused MS. These were people who already had it, number one. Number two, it didn't control for any other factors. There was no control group in this study. So if a physician tells patients to stick with a really rigid diet and then doesn't follow them for the next 34 years, not everybody is going to be able to do that. But it would be worth considering that some of the people that don't adhere to this piece of advice may also engage in any number of other behaviors over the next 30 years that could impact their health, their well-being, and their longevity. The study was not, again, designed to look at things like, or control for things like heart disease and cholesterol and body weight and level of activity, family history, all sorts of things that we now understand directly relate to health, well-being, and longevity. I would also add that for a study done of a treatment in 1948, before we had any of the science and the understanding and the treatments that we have now, is that study really applicable in the modern era? So I would say that neither dietary supplements nor specific dietary restrictions have been meaningfully shown in controlled studies to impact the course of MS itself. A healthy diet is advised on the principles, again, of general medical well-being. But I would tell you this, our goal in taking care of people with MS is not to have it limit your lives any more than it absolutely has to. Our goal is for you not to think about it any more than you absolutely must. As Dr. Fabian said, we talked about journaling. I'm not a huge fan of journaling every symptom and sign of MS also because I think it forces you to think about it all the time. Our goal is to have you not think about it any more than you need to. And I think a fixation on cutting things out of the diet runs the risk of making you think about and deprive yourself of things that add to quality of life. So I'm going to leave you with that, and I'm going to turn it over to Aliza Ben-Zachariah, who's going to follow this. And we're going to conclude with some principles that you can apply to everything that you see and hear about MS to figure out if it's myth or fact. Thank you, folks, and here is Aliza.
I will try to continue that great flow with a bit different accent, I guess. Let me just... Okay, so you heard Dr. Krieger talk about diet, different diets, and also about sweeteners. I'm going to focus about two... I think I do not need the podium. Two different topics related to some myths, fiction versus fact. The first one that I'm going to talk about is vitamin D. You heard briefly earlier that maybe there is some relationship between vitamin D levels and risks of MS. Do we have the evidence today? Is it a fact that vitamin D is really controlling the risk of MS? Is it fiction, fact? Is there some evolution between the two? Is there an association, or is it cause and effect? So let's talk about that. Is it a link between these two? So talking about vitamin D, we're going back many, many years ago, many moons ago, and it was mentioned earlier about the equator, about relationship between sun exposure and risks of MS. Areas that has high exposure of sun and heat has less MS. What's the relationship here? And we knew about this distribution for many, many years. And we know that vitamin D is an inducer here, so maybe there is some relationship that we don't know about. So, and just to give you an idea, sun exposure for about 20 minutes give you 10,000 international units of vitamin D. Diet has some vitamin D in it, but not much. But do not go tomorrow and burn yourself in the sun, even though it's free vitamin D, okay? We know the danger of sun, and I think we're all aware of it and well educated about sun exposure. But important to know, and we'll talk about checking it and times towards the end of the talk about vitamin D. So what are the studies that's behind it? What's the evidence? Do we have full evidence or just bits and pieces? There are some animal models that show that there is some relationship between vitamin D, the role of vitamin D in the immune system. It showed that it perhaps modified the immune system and make it more anti-inflammatory. Remember, too much inflammation occurs in MS, that leading to damage of nerves, myelin, and cause the symptoms and functional issues that you experience from time to time. So since there is a shift, maybe there is some benefit from supplementing vitamin D. Another big study that was done with many nurses over many years, it was mainly, though, an observational study that looked at nurses that supplemented with vitamin D versus none. There is some criticism about the nature of the study, about control for different variables, so definitely there was some weaknesses of the study. However, it showed a trend that when you supplement with vitamin D, you have less of a risk of MS. It's the beauty of it that sometimes we see the evolution between fiction to facts, even though we don't have the full facts that vitamin D is critical here in preventing or minimizing the risk of MS. So do we need to supplements? How much? How often? And these are questions that our patient asks us every day because they want to make sure they control the risk. Important not to cause havoc. So you want to check it. Talk to your primary doctor. Talk to your MS team or the pediatrician of your children. Maybe it's better to check once in the summer, once in the winter. I don't think we do not have any guideline as to how often and when and how much, but the usual trend among clinicians and MS specialists is you check the level. If someone is deficient, you supplement, and over time, you monitor the level. The risk of too much vitamin C, not always more is better, you can see, because too much of vitamin D causes too much calcium in your blood, and then it causes, paradoxically, also to bone problems. So too much, too little of calcium can lead to loss of bone, to osteoporosis, and other effects like heart problems and kidney problems. So you have to be cautious. Not always the more is better. So important to really note that. Next, so I mentioned already the evolution here. The fact, though, is that we know that vitamin D now, we have some evidence, I must say cautiously, that vitamin D is a modulator of the immune system. And hopefully we'll get more data in the future to prove that treating multiple sclerosis with some supplementing with vitamin D may reduce the risk of MS at some point, or maybe even related to worsening of MS. We need more research. Hopefully, I know that the National MS Society is involved. There are many other studies being done out there to look at vitamin D. Is it an association or cause and effect? But so far, today, we can definitely check the level and do something proactively, but be cautious. Don't supplement with too much. So did we reach our factor? Probably not yet. We don't have the full evidence. Next, I will talk about low-dose naltrexone. It's something that has been mentioned to me by many of my patients. Naltrexone is actually a product that is used for people that went into overdose from narcotics. Either you took too much of morphine or too much of other, so naltrexone really counteract that effect. But many of our patients heard that it reduced the relapse rate, that also it reduced progression of MS, so, and therefore they looking for it and supplement. And again, it's pill, it's tablets, it's easy to take. Everyone likes to take something that's easier. Something also to mention about this pill, that it's a compound. So you're probably familiar with some other medications that have been available in the past, like a compound, for example, dalfampridine, Ampera. So the danger of getting compounds that not always you're getting the same things. You can get one time a little bit of the actual real dose, and some other time other substances. So important to know that fact. And it can also, all these medication, all these substances you take can interact with your medication that you take for MS. So important to know that. The claim also that LDN treat many, many other diseases, and we mentioned earlier, something is too good to be true and directed at so many diseases probably has no evidence to it. The theory beyond LDN, low-dose naltrexone, as you can see, it reduces inflammatory factors like nitrogen oxide, or glutamate activity. Once it reduces that inflammatory activity, it can reduce the damage of nerves, myelins, oligodendrocytes, that big name that Dr. Fabian mentioned earlier. So again, that's the theory. However, we do not have the evidence yet. Is it a leap into the future? I will share with you two studies that I found from pronounced MS specialists. The first one from the West Coast by Bruce Cree, Elena Kornieva, and Douglas Goodin, well-known MS specialist. It's a study that was done recently and published in 2010. It was a small study, as you can see, 80 started, left with 60. The most important thing that it was well tolerated and safe, and had some improvement in quality of life. No other effect on the actual illness. Another, so again, small study. Another study which was open label, uncontrolled, and again, I think by now you're aware of some of the good trials that being done, controlled, double-blind, this is open. Everyone knew what they were taking. Again, small study. Interesting, they looked at primary progressive, and it was done by a well-known group in Italy, one of them known to some of us, Dr. Comey. So again, they looked at symptoms of MS, spasticity, depression, pain, and fatigue. They saw some reduction in spasticity, none whatsoever in fatigue, pain, or depression, and many of our patients tell us that it might be helpful for their fatigue. Again, no evidence so far, so we need more study to show, can it be relieving symptoms, or either actually the disease itself, as heard by many of us. So the fact is that currently there is no evidence that the use of low-dose naltrexone or LDL is an effective treatment for MS, and hopefully we'll have more evidence in the near future. So if you look out there, and as Dr. Creedle mentioned and Dr. Miller, when you look at the internet, there are a bunch and thousands and millions of objects that are treating MS, treating others. We mentioned 4 of them today, but there are many, many others. When you see something, please always get in touch with your team, someone that you feel comfortable with to discuss it. I always am open to discussion and looking at what my patients are taking, not only conventional medication. So in summary, there are some red flags that should stay in front of your eyes. This new treatment offer you cure? It tells you that's it, it's a cure for your MS. Question that. The second one tells you that all the treatment you are taking currently that are prescribed by your MS team and specialists, they are harmful for you. That should raise a red flag. Is it curing and treating many other conditions, and as I mentioned a few minutes ago? Do you have to pay for it in advance? Who is offering it to you? Is it only just the commercial out there, TV, someone soliciting your money for something? Anything of these objects that I just mentioned, or ways that you are being solicited and asked to take something, should raise a red flag. Always question, always seek more information. And the question that should come to your mind, what does the treatment involve? Is it intravenous? Is it an oral medication? Do you need to do other things? You need to purify yourself. Look at the details of each treatment, how and why it's supposed to work, how effective it is, how was it proven? You need to know the studies. Was it controlled double-blind study? Very, very important. What are the risks of this treatment that's supposed to cure you or give you better effective treatment? And make sure that you get reliable answer and always be open to discuss everything and get data from credible sources. This is really, really critical. This is something that I found online, as you can see, fiction and fact, and it says, brilliant report, Kimball. I can't tell you where the facts end and the fiction begins. I think sometimes for all of us, it's very hard to know what's real and what's not. And as we mentioned earlier, when we really have hope in our mind and we want to get better, we all, as clinicians and our patients as well, and caregiver and family, I think we always reach out to certain things, but make sure that it's a safe substance. Make sure that there is evidence behind those substances and products that are being offered to you. And I will end in that. Thank you so much for your attention. And